Okay, Meditech use for the pediatric emergency department. This is your tracker. These are the patients in said rooms or in rooms. I'm going to go ahead and highlight my patient here. I shall highlight this patient here. The first thing you may want to do is look at the triage note. You can go to the tab here and hit summary report, then triage sheet. It may default to print, but I don't want to print. I just want to hit preview, and I'll hit OK. And then this is the nurse's triage note. From this note, you can look at any relevant past medical history, and then there will be vital signs that are done on real patients. So you can review that. And then there'll be the chief complaint and a couple sentences of why they're here. Okay, after you've seen the patient or while you're seeing the patient, the next thing you'll probably want to do is document. So you're going to hit on the document tab. Okay, and what should come up is pediatric ED record. Okay, that's our template for the pediatric emergency department documentation note. And as you can see here, there's multiple tabs up here. The first one is HPI. Note that you have to hit these sections before finalizing the note. Section complete, yes. You can hit the date and seen by provider, but you don't have to. You can simply hit now if you'd like. Primary care physician, I usually write the primary care physician in there. Source, mother, and then here we go, history of present illness. You can go ahead and free text in why your patient's here as much as you want. These are functions that I don't use, but you can use ENT. This is sort of like I guess the old T score sheets. Can put that in. Review of systems obviously is pretty important for documentation. You hit section complete when you're done. Yes, all systems reviewed. Yes and negative. If you right click, it will cross a section out. If you left click, it will circle it. So any relevant thing here you can put down here, and usually hitting yes, all other systems reviewed, yes and negative um, will be helpful at times. Past medical history, no past medical history, no surgical history, and so on and so on. Physical exam. Here's your physical exam. Note if you hit the N up here, all the normal things will be circled in blue. You can also circle mild distress, and then moderate distress if they're in moderate distress. Note you can always go here to other and then free text in whatever you'd like. Smiling and playful. And you can also hit playful up here. Same thing for all these other physical exam sections, whatever you need to put. And then also I usually write down here in other free text. Well appearing, cleared auscultation bilaterally without wheezing or crackles, such and such. And then this is kind of neat, body images. If you need to put down something and describe something, that can be helpful there. And there's all sorts of body images. Differential diagnosis, section complete when you're done. If it's a patient with a fever, you can say what was on your differential: pneumonia, viral syndrome, UTI, mono, influenza, bacteremia, acute otitis. That was your differential, and that can be important also for billing and thought process. You can also write down stuff down here. Results, notice there's no section complete, but if they've had a chest x-ray or radiology, images reviewed by me, it was a chest x-ray, everything was negative or normal, just make sure you agree with what was circled. And then there's CT scan results and other results. Procedures, laceration repair, standard stuff, and so on. Course, this is pretty important. Progress note, so you hit whatever time it was, patient re-examined, abdomen soft and non-tender, PO challenge, well, no vomiting, took 6 ounces, whatever. and then hit OK, and then you could have a nice progress note. To get another one, you can hit the repeat button, and then another progress note comes up. There's a consultation tab. You consulted orthopedics, and here's your free text for comments. And here's the critical care section. You have to have at least 30 minutes to bill and request for critical care. And circle which one of these are true. And here's some further comment section. Dispo, you need to do this. So here's your diagnosis. So we'll say asthma exacerbation. I'll click on that. And any other secondary diagnoses, you can even put ruled out diagnoses, and then your plan. What I usually do is I'll type in a plan. So follow up with regular doctor, words that they understand in 2 days, plenty of fluids, return for, etc. Whatever other important instructions you want to write down. I'll go ahead and copy this, and I'll show you why later. I'm going to copy my plan here because I'm going to paste it in the patient's discharge instructions. Anticipatory guidance given, follow up with PMD as discussed, return to PMD if symptoms worsen, condition on dispo, good, fair, improved. I usually hit good. Most of the time they're good. Dispo to home. And then if they're transferred, if they're admitted, there's stuff down here. Once I'm done with my note, I'll go ahead and hit save. You can leave it in draft form if you're not done with it, or if you're all done, you hit sign. Oh, I didn't complete a section. I have to go back and complete that section. So I'm all done with my note. I'll hit sign, and then it'll ask for your PIN, and you can sign that document. Okay. Now to discharge a patient, you hit the depart button. If they're ready to be discharged, notice that their primary diagnosis from your documentation popped up there. So that's kind of neat. Patient discharge instructions, you can hit something that makes sense, asthma in children. I'm going to take off this one. So that's some standard patient instructions. It's in English or Spanish. And then additional instructions, this is where I paste additional instructions. Return for instructions I always put. Follow up with the doctor, and then any other specific instructions. This is if they need a school note. Notice that this is I, that means that there's additional stuff. So final diagnosis, you have to put, to me, this is in the patient's words. So asthma, attack or exacerbation, or respiratory virus, or whatever you put in there. And then referrals, you can put any referrals that are needed. Usually it's orthopedic clinic if they need that. And then prescriptions, you can enter prescriptions. You hit edit, and let's see here. It takes a while. Make sure that you review their allergies, which should pop up here. And then if they need a prescription, so I'll say Bactrim, I'll click on Bactrim. You can change any of these. You'll know 2 tabs, but you probably won't do. But if you want to do 2 tabs, 1 tab POBID for 7 days. Select, and you can review your order there. You hit save. Again, you can review your order. It's a new med. You hit file and exit, and the medication prescription should pop up there. When you're all done and you're happy with your discharge instructions, you hit save and print packet, and then ready to depart. And the packet will print out, and then they're ready to depart.